Here are the treatment options for stage 4 prostate cancer. So when a patient has stage 4 prostate cancer, what that basically means that the cancer itself is not only in the prostate, but it's now involving another organ outside of the prostate, whether it may have metastasized into their bones, or it might have gone into their lungs and into various other places basically. In dealing with the treatment of stage 4 prostate cancer, one has to look at whether it's an initial diagnosis, which means the person comes in, they've never had any treatment for their prostate, and so the prostate is still left behind. In that instance, more than likely, we're going to focus initially, first of all, obviously in a general assessment. We want to see, again, how old that person is, what type of issues are going on in addition to the finding. Because usually a person who shows up with advanced prostate cancer or stage 4 prostate cancer, they will have the presence of a lot of bone pain. And that's because prostate cancer likes to metastasize to the bone. In most cases, those patients will need to be placed on a treatment where the testosterone within their body is eliminated as quickly as possible as one of the first steps. The other aspect, and the way we will do that, is usually put them on some form of medications that will eliminate the production of testosterone right away. In addition, part of that evaluation will involve evaluating whether or not the cancer is involving their spine. And that's because that is a very important workup that we have to look at, because if there is some form of involvement in their spine, they may also need to have emergency radiation to those selective areas as well to ensure that the cancer is at least placed into some form of remission. Afterwards, once that person is contained in terms of the prostate cancer, then we counsel them on what other therapies will they need. Most of the time, those individuals are kept on a hormonal therapy to reduce their testosterone within their system as long as possible. Unfortunately, in most cases, the prostate cancer over time will develop some form of resistance to these type of therapy. And as a result, we then have to switch over to different types of attack mode that we have to use. One particular one is a treatment called Provenge. And Provenge takes advantage of the body's own immune system. In that instance, what happens is there's basically 3 treatment cycles. During each of these cycles, the patient's white blood cell is extracted from their body. Then it is delivered to certain labs that are located around the country, where the white blood cells will be exposed to these antigen products that will mimic the presence of prostate cancer. And as a result, these, and also material that will basically supercharge these white blood cells so that they're reinfused back into the patient within 2 days. And after this reinfusion, these white blood cells are basically fired up, and they go back in and try to attack the cancer cells. And so this is one form of treatment for advanced prostate cancer when it has no longer responded to the hormonal therapy that patients are receiving to eliminate their testosterone in their body. In addition, there are now also some oral agents that are available to take that can also treat advanced prostate cancer in which it no longer responds to hormonal therapy. One of these are called abiraterone, and what that basically is another form of hormonal therapy where it not only relies on shutting down the production of testosterone in the body, but these medications actually block the receptors on the cancer cells so that it prevents testosterone from attaching to it, and even prevents the prostate cancer cells from producing its own form of testosterone or own form of signals to shut down the cancer. And so that is another alternative. Now, when we go out of the management using hormonal therapy, then we usually migrate toward some form of chemotherapy. That, in most cases, is usually a last line treatment effect that we have to use for patients. And in most cases, that's when the urologist will refer to our hematologist oncologist colleague to start our patients on that type of therapy.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.